I think that we can go ahead and get started. And then as people join, I'll keep an eye out for our other panelists, but I think in the interest of time, we can get started with introductions, and then we can always allow her to introduce herself as she joins. So I just want to welcome everyone to our conversation. It really is a conversation today. Modern health, we just really wanted to highlight Asian American Pacific Islander Heritage Month and Mental Health Awareness Month, and really get a chance to talk to some of our professionals in our network about what this month means to them, tips they may have, but also highlighting the achievements and the work that people from the Asian American and Pacific Islander community have brought to mental health and how that has helped to elevate us. And so we have three panelists. I will allow them to introduce themselves in 1 second, but I just wanted to go over a few housekeeping things. So if you have questions, please feel free to send them to me in the chat, and I will be sure to bring them up to our panelists. If you have comments, please feel free to put that in the chat as well, but they may not be able to see that because they'll be focused on talking. And if you have any questions, you can feel free to message me individually. So I'll start and just welcome our panelists today. Modern Health is extremely happy to have you join us. I'm Dr. Jessica Jackson. I am the clinical care lead for Modern Health, and I'm a licensed psychologist. And I, for one, am very excited to be here today. And I will start with Avni. Could you please introduce yourself and share just a little bit about who you are with us today?
Yeah, my name is Avni Panchal. I am a licensed clinical social worker. And I have a private practice in Oakland, California. And I also do trainings and teach at SF State. Definitely a provider with Modern Health and have been for quite some time.
Thank you. And we also have Dr. Joanne Chan with us today. Could you introduce yourself, please, Dr. Chan?
Yeah, sure. I'm Joanne Chan. I'm a licensed psychologist in Portland, Oregon, but I'm also from the Bay Area. So happy to be here. I am a specialist in anxiety disorders treatment and OCD and related disorders, but I also have a niche in working with Asian Americans and Pacific Islanders on cultural identity development and just interpersonal issues and other issues navigating their world. So really happy to be here, and yeah, excited for the conversation.
Thank you. Great. So we'll start out with our first question. Is just a little bit about what does this month mean to you, right? What does it mean to you personally? Maybe what does it also mean for your clinical work? And how do you think about the intersection of Asian American Pacific Islander Month and Mental Health Awareness Month? So any thoughts that you have on that?
Mm-hmm. Yeah, I was thinking about this question, and I'm actually feeling like more proud as an AAPI therapist, more so than previous years, because this year's been super tough for our population. And I've been really impressed by how the Asian American and Pacific Islander community is like speaking out and trying to sort of bring attention to all these issues that we've been experiencing for so many decades and we've been quiet about. So I do think that like this year in particular, I'm just feeling really, really feel like we are being seen and we're sort of coming out of sort of like the shadows or the blending into the wallpaper. I feel like we're really starting to like define who we are. And I think it's about time, right? So I'm really happy about it.
I definitely have to agree with Dr. Chan. I think this is the first year that I even see us being in a conversation, and I don't think that's happened. And if it's happened, it's been like moments and spurts, but I feel like because of the racial unrest and tension last year with George Floyd and today being his anniversary, I think that's really sparked a lot of conversation for a lot of people, and AAPI community being the other one as well. This really sparking the conversation in terms of how we want to be represented. Representation matters. I mean, there's all these concepts that are being sort of percolating and talked about. So I think this is actually the first year where I have as much awareness as I did unlike other years.
Mm-hmm.
Yeah.
Yeah.
I think you both bring up interesting points about, I mean, this has been a tough year for many, many people, but especially for the AAPI community on top of COVID, with a lot of the anti-Asian racism. And I'd like to hear your thoughts on how is that presenting itself in mental health? Are there things that you have seen in clients that you're treating? Have you seen it in your community? Like, how is that? How have you seen that?
Yeah, well, I mean, it's coming up everywhere, personally, professionally. Um, I would say like my Asian clients have generally been very scared and angry, like a combination of both. Like it rightfully so, right? Like there's just so much to be angry about and to be fearful about. And what I see is different though, is that like what I just mentioned earlier, is that they're starting to like really want to do something about it. And when I've been a licensed psychologist for about 10 years, and I don't think I've really seen this kind of level of like wanting to be kind of out there and take risks and be involved in activism or in whatever way they feel is right for them, like whether it's like speaking out in their community or donating or like, you know, being part of like a group kind of process or, you know, like exploring themselves. I think there's a lot more action. And so I think there's just been many years of like us talking about it, and maybe like this, the combination of events have really kind of pushed it to the forefront and like really made us want to be honest and look at what we're doing as a community. Are we going to stand for this forever, or are we going to start to take some risks? I think we're ready for to take some more risks, which is really cool to see. So it's been a combination, but like it's a really mixed experience, like really negative and hard experiences, but also some silver linings in that people are starting to kind of speak out. So
yeah, and to add on to that, I think I wish I knew the exact research, but I've seen numbers be as upward as like 200% or 300% increase in the hate crimes, especially because of COVID. And you know, because not to blame or anything, but the government last year also, like our president was very keen on saying COVID is China virus and all. I think it just added fuel to the fire for a lot of the hate crimes to happen. And I think it's become more and more prevalent. I've also ran, in addition to seeing AAPI community clients, I've had dialogue circles that I've ran. And I, just like Dr. Chan said, that fear is real for a lot of people. And we have this sort of culture where we're sort of raised to not talk about things, even if we're different subcategories of the Asian community. I think the general overarching theme is, well, we don't talk about that. And I think that's the shift that I've also seen, is like wanting to have these conversations and wanting to really make sure that we are talking about it, because I think people also realize they're not isolated incidents, because they were happening so often, and they're very specific to the anti-Asian hate crime. And I think that that's been the pivoting point for a lot of people, that I've noticed. And on a personal level, even a couple of years ago, and this is before this being a conversation, but I remember I was like out in Oakland and someone like came and tried to like punch me, and I just had no idea what was happening. And so I can only imagine, I say that story not as a sympathy, but like I can imagine how like heart-wrenching it can be for people when it's actually going further than the attempt itself. So
yeah, I really am glad you brought up like talking about it, because with trauma, since like we've like as a people we've been through so many experiences, like traumatizing experiences, maybe not directly to us individually, but as a group. And we know that like that gets passed down in generations, right? And so talking about it is like a healthy way to process that trauma. And I see that trauma coming up a lot in myself and in my community, like just like feeling a lot more of hypervigilant, feeling a lot more kind of like easily triggered, you know, just like those like core symptoms of like what PTSD, what you would see in someone with PTSD are somewhat coming up more. So I think like the talking is so important, like just processing, having some perspective, knowing that you're being held in a safe place. And you can kind of look at those instances and feelings in a safe place. That's super important. So I highly recommend that as a way to kind of work through some of that trauma.
I agree. Having the conversations and being able to have conversations where people can share not only how they're feeling, but how they're coping, right? And recognizing that, you know, coping is needed. I think, Dr. Chan, you brought up a good point. You mentioned community, and I'd really like to hear from you all, like how you might define or how you think about community, whether it's very localized or a broader context of community and identity, and share a little bit about what mental health has historically meant or represented in your community.
Yeah, it's a good question. It's a complicated question. You think that like the word community is like simple, like people around you, but it's definitely more complex than that, right? I grapple with this in my own cultural kind of identity development. I know I have a safe tribe of other individuals I've grown up with who have a very similar experience that I could talk to about like just be myself and talk about like all of the worries or like the fears I have. But then there's this greater community that includes like my professional community, which I'm really starting to like tap into for support, because we are also going through something really unique. Like we're having to support people who are going through things that we may not have ever gone through before, like as a society, right? Like the pandemic and Asian Americans and Pacific Islanders speaking up more and getting angry. Like, so that's been really important. So I'm part of a little group at my clinic where we get to process our feelings as BIPOC therapists. I think that's like a really important community. And then I also think like my broader, like just Portland in general, like that community has been really important for me and my family. To just support each other through this time and to start to share our experiences, because a lot of my neighbors are white, and they ask me a lot how I'm doing with all of the violence and the hate stuff going on, and they're wanting to learn too. So I think there's like an exchange there that's really important. So there's like the safe tribe, and there's like learning and supporting in the professional community. And then there's like the broader community where like there's learning and connection. So far, that's how I'm kind of piecing it together. Yeah.
Thank you.
And same thing for me. I think I've always been big on wanting to have community because this, especially private practice. I mean, I come from the public sector agency world, but with private practice, it can feel very isolated, and it's very easy to get isolated in this arena. And so I've been very big on wanting to have community from the very beginning. I'm part of a few like professional network groups so that you have that camaraderie and are able to talk about what's been going on for you. And on a personal level, I really try to have a balance between like my mental health professional friends who are going to get what I'm doing, and then my non-mental health professional friends to kind of keep me grounded too, because I think sometimes when we're inundated with people's anxiety or depression or what's going on, that can start being our worldview. And so it's really helpful to have the other side who doesn't have who's not of the same background to really like show me like, okay, this is also a different perspective. So in terms of the professional and personal community, I think that's been really huge for me. And to your other question, I also think a lot of just conversations around mental health have started to be happening. So I remember, so I was part of a group practice, and I started my own practice back in December, and it was very intentional on wanting to make sure the directories that I was choosing outside of like our Psychology Todays. And I really wanted to make sure that I was like part of directories that were really like not only having the conversation for BIPOC individuals, but really doing the work too. And I'm very, to my pleasant surprise, there's a lot of those happening. Like I'm part of inclusive therapists, I'm part of South Asian therapists. So there's a lot more directories out there as well that are very specifically saying, we want to focus on culture because we understand that's a conversation that's happening. So I love that that shift is happening, because on a personal level, like my whole mission is I want to help destigmatize mental health in my community, because there is such a stigma. There's an incredible stigma of wanting to seek out for help. So I love that that is also a conversation that's happening on a mental health level.
I'd love to follow that thread a little bit, Avni, of the stigma that you're talking about. So what are some challenges that you feel that come up that kind of are barriers for people to engage in treatment or to engage in therapy intervention? And maybe if you have any context on like where some of that comes from historically, where does some of that stigma maybe come from?
Yeah, I know, so I'm an immigrant myself, and I know even though this is my profession, a lot of my family members like have no idea what I do. Like they think I probably read minds, or like I deal with someone who's very, very extreme in terms of their mental health. And I chuckle at it. But the viewpoints are just so incredibly skewed for a lot of people, because this isn't an open conversation that happens. Like no one sits and says, I'm emotionally struggling and I really want to talk about it and I want to seek help. Because a lot of times what ends up happening is there is a mentality of we have to figure this out on our own. And if we're asking for help, then you're being quote unquote weak. And that's a thread that happens in so many different subcultures too. Like I identify as Asian Indian. I see that very common in my community, but I also see it with other Asians that I work with in my practice, where they have really struggled with saying the words like I'm feeling anxious or I have anxiety. And just giving that language can be really powerful, but also very scary, because their next thought is, well, how long will this go? And does this mean I'm doomed for this forever? Because there isn't as much understanding on the mental health piece. So I think that stigma is real. And if people feel like they have to go to therapy, it's because they've gotten to the really extreme, and that's why they need to see a therapist. When in reality, a lot of this work could be preventative if we started having those conversations. And I think the younger generation and the young adult generation is really realizing that. And there's still struggle with the parents and the people in the older generation. Not to say that they're not coming, but I think that shift is slowly happening, which I appreciate. But that stigma is real for a lot of people, feeling like I shouldn't ask for help. I should be able to do this on my own. And I'll kind of table this for later, like another question, but I also think the idea of model minority gets in the way as well, because the idea is you should have it put together. So
yeah, I couldn't agree more. That's a really good point about they don't know what to look for, or even know how to talk about it, right? So I was just thinking like the language, not in terms of English, but just like the jargon, the clinical jargon. Like how would they even know what to look up if they've never talked about it? If their parents have not talked about these specific conditions that you could suffer from, and then realize until it's too late, like it's really, well, not too late, but like when it's really extreme, when they are really suffering, and then they come in and realize they need help. So I think like education and starting these conversations about mental health, that like you could get depressed. Actually, half of the population gets depressed within their lifetime, and anxiety is super prevalent. And there's also these really specific kind of idiopathic issues that that people don't know about, like hair pulling or skin picking, things that like people may engage in for a long time, and then it gets really bad, and then they realize, oh, they need some help. So there's just a lot of like awareness that I think our generation is needing to develop and is developing. And I agree, like the younger generations are a lot more keyed into mental health, and that there are all these ways that you can get help, and that there are a lot of steps you can take. So
Yeah.
there's hope. Yeah.
Yeah.
Mhm.
I appreciate that. I like the thread, this idea that, because listening to both of you, you also have, it sounds like, hope and optimism that the stigma can be reduced, if not eradicated. And, we talk a lot about like a younger generation is more open, but I'd love to hear your thoughts on how can not only people within the AAPI community help reduce stigma, but how can allies help to support in reducing stigma to mental health and mental health treatment?
Honestly, I think normalizing it is going to really help, just as the first step. A lot of the work as therapists that we do, not a lot, but a good chunk of it is normalizing what's happening for our clients and how they're feeling, and just normalizing that is anxiety. That's what anxiety does, or that's depression, and that's what depression does. And really having understanding on that can be really helpful. So whether we're an ally, whether we're in the community ourselves, openly having those conversations. I think being vulnerable is really scary for a lot of people. And there's this idea of like, I have to lay bare and say everything that I'm feeling to be vulnerable, when reality, vulnerability is more a conversation. You get to just start with saying a sentence like, I've been really anxious today, and see if the other person takes that kernel. And I think those could be the little step that we start talking about, because I do believe a lot of times in the community, there's this way of like, we have to assimilate. If you're someone who's immigrated here, like you have to assimilate, and you have to make sure that you put together, and like there's all these assumptions that we're making. And so when things don't work out, which life, I mean, that's life, it feels very burdensome, because the expectation that we've set is like, well, we should have had everything figured out. And normalizing those like challenges that we could naturally have just because of course of living life, that can be very helpful.
Yeah, I agree. There is kind of a common thought or belief in within the AAPI community about like needing to kind of have their ducks in a row, or like control, or like needing to do certain things to succeed in life. And whether it's like having a house or good job, family, whatever that is, like I think there's an expectation that you should be happy, like you should be satisfied. And when they realize like, actually that doesn't equal like satisfaction or happiness in the way they expect, there's this like kind of confusion, or like just feeling lost, like what do I do now? And so I think, yeah, normalizing that mental health affects everyone, like really successful people, everyone, people with a lot of money, people who have like seem to have everything together, it affects everyone. So like all these things that you think you have to do to like avoid mental health problems, it's not really the formula that works. And then there actually is a different formula that I want to share with you. And it's usually kind of mind-blowing, like doing less, or, taking a break, forgiving yourself for something. So, yeah.
Yeah, and I think we had a few comments in the chat of people who can relate to that, but also recognizing someone, at a very specific point that I'd love to hear your thoughts on, is that expression of feelings doesn't come easily, right? And so often when we think about therapy, we think that that's a large part of therapy. And I'd love to hear your thoughts on helping people to, when we talk about normalizing it, that sometimes, I'd like to hear your thoughts on where feelings come in and what can help people maybe feel a little bit more comfortable figuring out how they express feelings, or even being able to simply share feelings.
So I give permission to people to say it's okay if you're not ready to share feelings. partly selfishly, because I know when I was in this profession, I was like, yeah, I'll pursue this, and I don't want to talk about feelings. And I'm the therapist, so I allow that as permission for people to say, if you're not ready to talk about your feelings, or if you're not ready to talk about your past or your childhood, because I think sometimes that's the other thing that people think is like, oh, if I go to therapy, I got to talk about my relationship with my mom or dad, which is not always true. It definitely comes up, but it's not always true. And I think just allowing that space for me as a therapist, really allowing that space to be more client-centered can be very, very helpful. So that when that comes up, helping them name it and express it further. Because what I notice is a lot of times people say, I'm fine, or I'm good, or it's okay. That's not a feeling. Tell me what you're really feeling. But those things can happen once that engagement has built with individuals. But I definitely come from a household where we didn't really share I love yous or I miss you. And I knew I was very I was very protected and loved. But that wasn't how my family expressed love. And so even giving permission for people for what their view is on how love is expressed and how it could be different for different families, that can also be helpful, because that's another like guilt and shame that's being carried as well.
Yeah. Yeah, and I also think like educating clients about like the possibility of having multiple experiences at the same time is really helpful, because I've noticed that a lot of clients will say, well, I was happy, earlier today. I mean, I should be happy, but for some reason, I just don't feel that way, but I should be happy, right? Like all this stuff is going well in my life. And like it's like this black and white approach to feelings, like, oh, either happy or I'm sad. And I can't really kind of be somewhere in the middle, where oftentimes we are usually somewhere in the middle. Like I may be really excited, but also afraid, or, like maybe I'm feeling sad and kind of hopeful at the same time, right? There's several things that could happen. And I think that's a nuance that, because there's not a lot of talk about mental health and feelings in our households growing up, like those nuances are not really understood or known yet. Like I think it takes a lot of processing and talking about it before you can start to see the more kind of sophisticated kind of nuances of experience and emotion. So I think that takes a lot of like just discussion and conversation.
Thank you. And I want to come back to this. Our third panelist was able to join us. So I just want to give her an opportunity to introduce herself and to share a little bit before we jump back into our questions.
Thank you so much. I think there was some confusion. I was trying my best to get in, finally could in. I am Runjun. I work at the Weissman Institute, and I'm an LPCC, licensed professional clinical counselor. I have been working and specialized in eating disorders. So I work majority with teens and adolescents struggling with depression, anxiety, and eating disorders. I think I'm very passionate about this work, and we have been doing a lot at Wise Mind just to understand, educate not just ourselves as therapists, but also how do we be effective with our clients. So I'm glad that I could be here, and thank you, Modern Health and Jessica, for like giving me this opportunity.
Absolutely. Thank you for joining us. So we've been talking, I think, a lot about in very specific communities. And I want to think about a little bit more generally. I want to hear your thoughts on the role of culture in mental health, right? I think that prior to this year, there's been a lot of emphasis on it this year for all communities, but I think specifically also for the AAPI community and really the Black community this year. And there are people who don't always quite understand how the two come together, right? How is culture and how is mental health related? And I'd love to hear your thoughts on how the two are related.
So I would say that when it comes to the whole aspect of mental health in at least the Indian community that I have been noticing, there is a lot of still stigma around it. There's a lot of like thought process going around what is actually therapy. And I think that kind of sometimes stops them from coming in, that stops them from having this open-mindedness of you have to be having a diagnosis, you have to be having this in order for you to seek mental health treatment. I think like that sometimes is also related to why we don't see as many people wanting to be a part of mental health treatment from that community. And I think sometimes it gets mixed up with how insurance works. Like sometimes, yes, you have to have a diagnosis. So I think like that plays a huge, huge role. And I can see as upcoming generations, they are trying their best to get there. They're trying their best to open their minds and be open to this mental health in general.
I also think so culture is absolutely important. I think we talk about it. I think it's on the same lines of like we all have biases and culture is important. But what does that look like as an action, right? Because I'm that's my logical brain. But I really think about it in that manner because if I'm the therapist and someone said, well, we didn't do that in our household, am I picking up that kernel and asking a follow-up question? Am I saying, what does that mean? Because I think that's the nuances that are really important. More and more so, I think, especially, yes, AAPI community and the Black community, more and more so over the last couple of years, there's been this push of wanting therapists of color because there's that understanding that a therapist of color may have. And I do think you absolutely could be a therapist that's not of color and still connect as long as you're able to pick those kernels. Because I think what ends up happening is for people who are not of color, it's that privilege piece and it's that like I'm not even seeing that as an option to pick up. And I think that needs to change in terms of the cultural humility, because even as an Indian, I tell people, yes, I'm South Asian and I'm not going to sit here and assume that my Indian experience is the same as yours. So when I don't understand something, rather than making an assumption, I'll just ask you a question. And if I do understand it, I'll kind of move along, but I'll still kind of check in and say, okay, is that kind of what you meant? Because for a lot of people, it's been very helpful to like, I don't have to explain what joint family is or what arranged marriages and how that gets done in my community, because you sort of understand it. And I will still ask that follow-up question. So I think culture is absolutely important. And are we as therapists also paying attention to those kernels that people say, because it doesn't always show up as race and ethnicity for people.
Yeah, I couldn't agree more. Yeah, it could be regional, like where they live. Like you could have an Asian person who grew up in the South and someone who grew up in California and have totally different experiences. So yeah, I agree. It's like, it's really important that mental health professionals sort of slow down and create space for that discussion, because otherwise there is a lot of stereotyping that is being made in those rooms. And like, so one example I was thinking about was in grad school when I was supervised by a white female supervisor. And, my family likes to give gifts. So we give gifts whenever we go to someone's house, we bring something. Whenever my parents come back from like Asia or something, they're always bringing gifts for people, like my teachers and neighbors. And so it was Christmas and I was like, okay, I'm going to give a gift to my supervisor, not really thinking, oh, that's not appropriate. And unfortunately, it wasn't like something my supervisor felt was appropriate, and it felt shaming. And I think like, even though I agree, like I could, I needed to learn how to give a more kind of maybe a more appropriate gift, like make something instead of a gift card, which is what I think I gave her. I think the conversation wasn't had about like my culture and like how it came from more of that rather than maybe thinking I was doing something inappropriate as a supervisee. So I think those are some things that like we can overlook and like maybe gloss over as therapists sometimes if we're not really careful, because we may like project whatever the majority culture like is onto that client, and it's often not their experience at all.
Yeah, I really appreciate, because what you're saying is similar. I think, Avni, you used the word like cultural humility. And so we have a few more questions. And then if anybody who's joined us, if you have questions in the chat, please drop them. We'll definitely ask them, but we have a few more questions for our panelists. And I want to follow this thread a little bit of when we think about cultural humility. I think we know in the US, right, there are not enough providers to match population. So if everybody who matched my social identities wanted someone who you like match your social identities in general, that it just doesn't exist, the numbers. And so I appreciate what you all are sharing about there are ways for other therapists to learn about how to infuse and think about culture in their work. And one of the things that I think gets forgotten also about therapists across the BIPOC spectrum is that also we're more than our social identity, right? Our clinical, our clinical skill is also a form of diversity. It's a dimension of it. And so I would love to hear you all just talk a little bit about maybe your clinical background. And I think this also goes to normalizing some of the language about what does it mean to be a licensed social worker or a licensed psychologist. But also talk a little bit about some of the clinical things that you treat or what do you normally work with, so that people can also see that not only can you match with someone who represents you, but also you can find people who don't and who specialize in things. So if you could speak to that a little bit.
I could start with that. I am a licensed professional clinical counselor. So majority of my work, I know these licensings are pretty confusing. So this license basically is pretty new to California. For a couple of years it's been around, but I know majority of the universities around focus on marriage and family therapists. The only difference that I have noticed is LPCC helps with people who are, coming in from different states and want to have a support here or want to kind of start their career here. So when I moved in from Maryland, the only option I had was, yes, LPCC, because probably Maryland state does not focus that much on, marriage and family and kids. So I had to take extra hours for completing, the certification for working with kids and families. But I have noticed like almost across the country, the amount of work and the amount of education that you need to get is pretty similar. And I work specifically with eating disorders in teens. So it could be anybody struggling with anorexia, bulimia, ARFID, or any of like the NOS population or diagnosis. And I think that oftentimes it comes back as, would this person understand, would this therapist understand what my situation at home is in terms of what we eat, or are you willing to work around that? Because a lot of times when parents come in, they have got this meal plan and they're like, oh, according to meal plan, we should be having this. And what I focus more on as a family, what is it that you eat? What is it that you are willing to eat? And let's focus and gear around it, because I feel it's important to, just like cultural humility, an ability to understand that every family eats differently. There's no right or wrong. It's just let's focus on how can we get your child nourished. So I think that's also important for us to keep in mind, that along with understanding the culture, we cannot generalize it saying just because they are from this culture, they must be eating all of this.
That's an excellent point. Thank you for highlighting that.
Absolutely.
I guess I can share. I'm a licensed psychologist. Specifically, my degree is a PsyD, which stands for Doctor of Psychology. And licensed psychologists can either be PhDs or PsyDs. So the PsyD is different in that my graduate program was a practitioner scholar model. So what it taught us was like to know how to look into the literature, to be able to evaluate it effectively and be able to kind of use it to guide treatment. So I was trained in evidence-based treatments. And like we did some research. I actually did a kind of a heavily researched dissertation, which I didn't have to, but you could kind of veer more into like qualitative work as a PsyD or doing a lit review. So it was a lot more like liberal in terms of the research. But the practitioner sort of aspect was really emphasized. So we got really solid training in evidence-based treatment. And I'm a specialist in anxiety disorders, OC related disorders. So that includes OCD, trichotillomania, skin picking, hoarding disorder, so there's like a whole category of that. And then trauma and stress disorders. So I use exposure therapy as my main modality, and specifically an ACT informed, so acceptance and commitment therapy informed exposure response prevention approach.
And I have a license. So I'm licensed clinical social worker, and I think people sometimes see LCSW and LMFT, just like Ranjan was talking about. LPCC is another one. And essentially, the main difference is with social work, there's more focus on the person's context as well. Not to say that LMFT doesn't have that. I think that's definitely the case as well. But I remember when I was choosing between an LCSW or an LMFT or MSW, Masters in Social Work, or Masters in Marriage and Family Therapy, I realized I could do more things with an LCSW, although that's changing too, to be honest, where a lot of positions and agencies are like, you can either be an LCSW or you could either be an LMFT. So essentially, if you have a license, either of those, you could be running your own practice, providing therapy, and you're essentially seen as an expert when it comes to mental health and giving diagnosis. You're not able to prescribe medication because that's a psychiatrist's role, but you are able to provide a diagnosis and do therapy. In terms of my own clinical, so I originally started in child welfare, and so that's been my background. And in private practice, I really work with clients with anxiety, depression, and I see individuals and couples. So relationships is another factor. And what I've sort of drawn, and I have this on my website, and I think I also get a lot of clientele in this arena, is around identity. And the way I describe identity is whether it's racial identity, sexual identity. I just started my career and I don't know what I'm doing, but identity sort of shows up for people with stress, anxiety, self-esteem, depression. So it has layers, but I kind of call it as like, I work with identity because that's what I keep getting clientele, and people get drawn to that. So that's been sort of the main focus. But because of my child welfare background, I also do a lot of trauma work, and I'll do cognitive behavioral therapy and dialectical behavioral therapy, which has the mindfulness component in it that I absolutely use in my therapy sessions.
Thank you. I think that's helpful because often we talk about what are barriers to treatment, and we don't help people to think about when they're looking for a provider, right? We just say, look for one, right? Psychology Today, Google it. And they're like, what do these letters mean? How do I know this person is able to work with me? I have one final question before we just let any comments or questions from people who have joined us, and then we have additional questions if there's not a lot of questions there. Is thinking about, you just shared your clinical background. Are there people or organizations from the AAPI community who you feel have really helped to advance mental health within your community, or people that inspire the work that you do? If you could just kind of share that with us, or if you even think about what are contributions that the AAPI community has made to mental health, because I think that gets left out of the conversation often as well.
Yeah, I think one of the most notable kind of researcher scholars that I have been following throughout my career is the Stanley Sue and Daryl Wayne Sue, the Sue brothers. And I think they've made a huge contribution in that they were able to kind of put in a model a cultural identity development process, the racial cultural identity development model. And it made so much sense to me when I first learned about it in graduate school. And that's what I've been using in my work with AAPIs as well as non-AAPIs. So everyone seems to respond well to that process. And I just think that was a really important contribution to the field. And I'm sure they're still doing really great things. So wanted to mention them. Mm-hmm.
I heavily use Insoo Kim Berg's solution-focused therapy in her work, especially because of my background in child welfare, because you don't have as much time. And so I definitely like love her work and all that she's done. But I also think in the most recent, there are a lot of different organizations that are starting. So I know there's like this Let's Talk panel that happens for AAPI community with in conjunction with, I believe it's Boston University, and I'll definitely share the link. But essentially they have like these conferences that they do for parents, for students to really just talk about mental health. So that's one. I follow Brown Girl Therapy. That's another person that's really sort of tried to destigmatize the idea of mental health. And like I said, there are specific directories that are also trying to do the same work of just like destigmatizing mental health. So I kind of follow different people around this.
It's interesting that you mentioned about brown girl therapy, and let's talk, because that is definitely a place where I go as well to talk more about and just learn more about what is going on. And at the same time, it's helpful when, you know, my clients also sometimes want some areas to just be there and understand. So having them on like social media platforms, which is easier for clients to also reach out to them, has been like one place where I kind of, and I keep digging into like, how can I make this easier for my clients as well to, you know, have that as a resource.
Thank you. Thank you. I'm definitely familiar with the Sue brothers, and I've definitely heard of Brown Girl Therapy. And I'm going to look into the other resources that you guys have shared, because I think that's a part of it when we talk about learning in culture. I'm not always learning what are the deficits and what are the barriers to treatment, but who is also teaching us how to work with different groups and how to have a deeper understanding, right? So that's important. So I just want to check to see if we have any questions for anyone that has been able to join us today, or any comments. Please, you can feel free to put them in the chat if you don't want to speak. And while we're thinking about if anyone has any comments, please let me know. I also want to give you guys an opportunity to think about, are there things that we didn't ask you today, that I didn't ask, that Modern Health did not ask you today, that you think is really important related to this conversation that we're having today?
I think I would just like to add on and like pull the plug up, put the plug back on like this concept of model minority, because it does like run through the AAPI community. And I think that does create a barrier to mental health, and really seeing it for what it is. It started as wanting to separate the races and ethnicity. So really seeing it from that perspective can be helpful, because I think we as a community have really taken it on. And I've seen it even when I was growing up in high school and middle school, of like what subjects or what careers I was offered because of how I looked, or when I didn't do well, or if I like didn't get the grade, you know, how that is perceived. And I think it's a disadvantage to the community, because for the people that are not able to meet that barrier, there's the guilt and shame for must be something wrong with me. But then even the people who make it, and I put make it in quotations, the pressure is so incredibly real, because as a therapist, that's what I see, is that pressure of I didn't get the project and now I'm having a panic attack. So I just want to put a plug back, because this idea of model minority can just be so damaging to the individual and the community, because we're essentially asked to hold a standard that is it's just not something we can meet.
Oh, and it keeps us quiet, because, right, like if the majority culture wants to do something and we actually want to do something different, we say something, then we're no longer model minorities. We're no longer like the good kids anymore, right? So I think it's really keeping our voice quiet, and then because of that, we're not getting our needs met in our society, because no one's speaking up for our needs. So yeah, I agree with that. Like it's time to get messy to like show who we really are and say, hey, we're really not that. We don't want to like conform to everything. Like there are some times when conforming is helpful or beneficial, but not all the time.
No, I agree. I think like also it comes back from like a lot of times the guilt that parents kind of share with the kids as well. Like if you are seeking help, you are seeking mental health help, something's wrong with us. And I think that adds to that guilt. And then, the client, even if they are asking for that help, they're voicing it, it kind of bears it down to, oh, I shouldn't be doing this. And there are a lot of like shoulds and coulds that I hear as a therapist, and wanting to, put that out there that it's not wrong to seek therapy. Like there's nothing right or wrong in that. It's more so understanding that it's just a neutral person helping you and your child get the perspective that would be helpful for their future. But I feel definitely as a minority, it does come back to, oh, we shouldn't be talking about this. Just get your grades, get A, and then move on from there.
Yeah, I appreciate that. And I was just reminded there was also Dr. Joanne Chan, Division 35, I think. She passed in the past year, was a big influencer in womanist and feminist therapy. I'm in psychology, and I think they actually have a like a scholarship or something that's in her name now. And that was reminded in the chat to recognize when you think about contributions. She made a huge contribution on the field of psychology. We just have a few minutes. So in that few minutes, I would love if you all would just share any final thoughts or mental health tip that you would offer to people in your community, however you define community, but kind of your final thought, a tip that people can take away from this or take away from Mental Health Awareness Month.
Yeah, I love this question. I have so many tips, but I'm going to just say one for now. I think sharing your story is really powerful, whether it's writing it out on your own and never like, maybe you just share it with yourself. That could be still like processing your story, or talking to a friend or talking to a therapist about it. But that allows for some perspective, and with perspective can come growth, because then you can kind of figure out, okay, well, what do I want to do next? When you keep it in, it's just brewing, and it can cause all sorts of anxiety and depression. So that's one of my tips.
And my practice name is Strength and Self-Love. And so I always, I have it on my website. I tell clients all the time that asking for help is a form of strength, and it's also a form of self-love. So just having that reminder for people, because I think that first step of even acknowledging to yourself can be very hard, of saying this is not working, and then to go to someone else is even more scarier. So just recognizing that asking for help is not it's a sign of strength, and it shows courage, and you're then practicing self-love to say, I don't have to do this alone. And so I just would love for people to hear that.
Yeah, I think where I go from usually is asking them to kind of take a pause if possible, and just try and reflect it every day on how their day was and what was it that has helped them to kind of understand that there are things that need to be spoken about, and there's some things that they are stopping themselves from doing. So I think it's important, even as a community, I think passing on, like, were there any microaggressions today that triggered me? I think sometimes we don't stop there. We just kind of brush it off and like continue. So oftentimes I tell them, like, let's pause. Sometimes just pause and see how it feels. Are you in the right space? And if you're not, let's talk about that and go from there.
Thank you for all of the tips. Thank you for the conversation today. I appreciate the community. I appreciate all that you shared with us today. I'm excited for many people in our member network, for people to hear this around the globe. I just want to remind people that all three of our panelists today are in our network, and they absolutely are open for new clients. So please feel free to reach out. We're happy to connect you, to look in the app, they're there. And I appreciate those who tuned in to us today. And thank you for all who will listen to the recording. I think there was a lot learned today. And I am grateful that you all joined us to really help us to gain a deeper understanding just of the relationship with the AAPI community and mental health today. So thank you so much.
Thank you.
Thank you so much.
Thank you so much.
Thank you.